Women's Health Connecticut is the largest ObGyn physician practice in the region and solely focused on women.
Joining us today is Dr. Keith Falter. He is an ObGyn provider in Danbury. Doctor, how are you?
I'm doing well, Jackie. Thanks. I appreciate you having me on to discuss the benefits of seeing your ObGyn for contraceptive visits today.
So, obviously birth control pills are available by prescription, but many women are taking to buying them online. Can you talk a little bit about the reasoning behind this new trend?
Sure. Honestly, I think it's convenience. People are so busy today that they're looking for anywhere in their lives to gain an extra 5 to 10 minutes back. My concern is that I don't think health and well-being is the place to try to cut that corner. Many of our contraception visits are young, healthy women, and we have the opportunity to help with so many aspects of that visit and improve their health. I hate to see anyone miss that opportunity. The ones that aren't healthy looking for contraception, well, those are the ones we really need to see.
So what can you tell me about how some of the risks of this outweigh the benefits to buying them online?
The Women's Health Connecticut doctor, nurse practitioner, PA, midwife, we perform screening questions and physical exams at the time of that visit to kind of help best individualize treatment and find the best, most convenient, and the safest option for each woman who comes in.
Why do you recommend having a doctor follow your care when you're on the pill?
That's a really great question. There are so many different contraceptive methods, and each one kind of has its own different risk and benefits. Some help lower cancer risks. All of them have some potential negative side effects and risks. And those vary from not only method to method, but also from woman to woman. Even pills aren't just one size fits all. There's different doses, durations, and even different families of birth control pills. It's best to have an expert who knows what to look for and someone who can counsel you what to look for when you're not in my office.
I know that oral contraceptives have uses beyond birth control. So what are they and how else are women using them?
So to be honest, many of the women that I come to see me for a contraceptive method, they're not there just looking for birth control. They can help with unpleasant cycle-related symptoms like bleeding, like mood swings. Some women use them for acne or other conditions like polycystic ovarian syndrome. And in those situations, there's other types of screenings that need to be done at the same time. In some situations, certain types can even be used to treat precancer and low-level cancers.
What are some of the things women need to consider when they are buying them online?
As a whole, a lot of medicine over the last, I don't even know how many years, has kind of transitioned to both preventative and individualized healthcare today. And I think a lot of women have come to expect that individual care. Women's healthcare and contraception care, it's not a one size fits all. I think that the online algorithms likely do a good job of picking out some of the risk factors, but they don't individualize care the way an expert can. Jackie, you're not a number. The women watching and listening to us today, you're not a number either. Some of you are athletes. Some of you have other conditions like polycystic ovarian syndrome. Some of you have cancer in your families. Some of you are planning to get pregnant in the next 6 months, 1 or 2 years. These are all really important considerations when you're determining not just what type of contraception is okay for you, but which one's actually best for you. When a woman's planning to build her family, there's a lot of things to consider. The best type of contraception is just one of those things. The doctors and other providers at Women's Health Connecticut can actually address all of those concerns at the time of your visit to help you plan your individual family building needs. Women's healthcare is obviously something very near and dear to my heart. I think that every generation has probably felt something similar, but given the current atmosphere, I think we all need to protect all of women's healthcare and do all that we can to ensure women still have access to the best, safest, and most individualized healthcare available. As the medical director for Women's Health Connecticut, I know that it's the goal of all of our doctors, our nurse practitioners, our midwives, PAs, and all of our administrative and office staff as well.
Women's Health Connecticut provides comprehensive ObGyn care and compassionate support as you navigate through each stage of your life.